Hand and finger injuries are very common in Jiu Jitsu. Let's look at some of them. First, the anatomy. The bones of the wrist are located here. The bones in the palm, the metacarpals are here, and the bones of the fingers themselves are here. The fingers are numbered 1 through 5, starting with the thumb. 1, 2, 3, 4, and the pinky is 5. There are several ligaments in the hand and fingers, including the collateral ligaments. Ligaments are bands of fibrous tissue which connect bone to bone. Overlying this, we have the tendons. Tendons are bands of fibrous tissue which connect muscle to bone. That's how we move our fingers. And many, many muscles in the hand. And then we have the skin itself. A very common finger injury is a simple scrape or abrasion. We've all had those. Treatment for that can include washing with warm water and soap and applying over-the-counter bacitracin antibacterial ointment 2 to 3 times a day until it heals. Another finger injury would be a laceration, a cut. Any deep laceration, you should have a teammate drive you to the immediate care for possible suturing. Another common finger injury is a muscle or tendon strain, STR. That's when a tendon or a muscle is stretched beyond its normal functional capacity. Symptoms can include pain, swelling, and decreased range of motion. Usually rest, icing, ibuprofen, Tylenol, and possibly a finger splint if needed resolves the condition. Another common finger injury would be a ligament sprain, SPR. This is when a ligament is stretched beyond its normal functional capacity. Ligaments are bands of fibrous tissue which connect bone to bone. Another finger injury would be a dislocation. A dislocation is a separation of the bones where they meet at a joint. If you feel it's possible you've dislocated one of your fingers, have a teammate drive you to the immediate care right away for evaluation. Certainly another common finger injury in Jiu Jitsu is a fracture, an actual break in the bone. If you feel you've suffered a fracture, of course, be evaluated. It is important to always be evaluated by your physician for any hand or finger injury.